So welcome back. So today I'll be discussing with you in a brief detailed manner about the section 3 of the HCPC International Application Form, which is the professional experience section. And in this section, you don't need a perfect format. There is no perfect format to this to structure this out. But the things that you need to keep in mind while filling up this section, that is the section 3 professional experience section, is you will have to mention in the beginning where you are. Like, you'll be starting with your current work status, so where you have been currently working, or maybe where you have just come out from and you're looking for another job. So where's your current workplace? So you'll mention that name over there first. How long have you been working in this organization or with this trust? And also, how many hours do you do each week? You can mention all these three things, which is quite required. After that, what you can do is you can structure out a format where you can mention about the different conditions that you've seen in this place. When it comes to physiotherapy especially, you've got so many different conditions. For example, if you are a physiotherapist working with the elderly population, you'll have seen conditions like stroke and Parkinson's disease, and you would be rehabilitating a patient or rehabilitating someone to get back to walking, maybe after an injury or a hip fracture or soon after surgery and all that. So you can mention all those conditions over there, maybe giving a brief description of the way you have seen these people. Okay, and next you can mention about the way you have assessed them and analyzed them. So assessments, it could include any physical assessments that you've done, be it the brief general examinations that a physiotherapist does, the subjective, the objectives, as well as any assessment methods that you have used as a person, which has helped you or which you have learned during your trainings, or where you have learned out of it, like where you have done a short course and you have implemented those ways of assessment in your patient. You can mention that as well. The next thing is outcome measures. So after you've done your assessment where you mention about anything, how the patient's gait is and all that you'll be mentioning in the assessment part. After that, you will be mentioning about the outcome measures that you've used for your patients. It could be like, if it's stroke, what are the scales that you used, Parkinson's, what you have done, or maybe any other, if you are a pediatric physiotherapist related to your, like, it could be the developmental milestones and developmental delays that you've seen, and the outcome measures that you've used, or if you're a neurophysiotherapist or an MSK physiotherapist. So according to your scope of practice, you will be mentioning the outcome measures that you've done. The next one is the outcomes or the interventions or the managements that you have put forward with these caseloads or with these patients. How you managed, how you executed a care plan for each patient, and how did this plan of action work, what were your goals and all that, how you discharged the patient or maybe referred the patient to another speciality or another specialist. Okay, the next heading that you have to keep in mind is how you documented the whole thing. Like, each and every patient will have a documentation in place. So how have you documented your work or your plan of action with each patient? What were the measures that you used? How did you do the reports? How did you put in individualized case goals, long-term goals, short-term goals? All that can be mentioned. How you managed can be mentioned. How much duration was the treatment time and all that can also be mentioned. And the next thing that you can mention in this section is about any additional trainings that you have got, and just in brief, nothing elaborate, because HCPC doesn't want to know about any short courses that you've done or day courses that you've done. You can, in the future, you can keep all that in your CV, not on this one. So just mention any you know, just mention that you're always updating yourself with newer research articles and trainings, but not giving anything so much in detail. And then you can definitely mention about your community postings if you've gone for all that, and how you've worked in groups, group practices, like especially for us elderly physios, like who work with the elderly population. We do have a lot of group practices and group sessions and all that. So all that can also be mentioned if you have gone through all that, or if you've volunteered for any groups and stuffs like that. So this is basically a structure where you need to, which you need to keep in mind while filling up this professional experience section. So I'll mention about this in the description box as well. Thank you all so very much for supporting all the videos, as well as sending in your queries. Keep sending in your queries. I will be making more videos based on your queries as well. Thank you all so much, and God bless.